Hi, everybody. Welcome to our monthly podcast by Bia, for you, for them. This is a podcast where we talk to expert physicians from the community to talk to us directly and tell us what are the things we should do, what are things we do not do. These physicians are giving their time voluntarily to help us understand what we can do every day with credible information so we can make a change. Last month was Lipid Awareness Month. This month, to continue that tradition, we're going to talk about obesity. Obesity affects 1 out of 8 people globally, and the numbers have doubled since 1990. It's definitely a huge pandemic. Today, it's my honor and privilege to welcome a highly accomplished physician, Dr. Kris Vijay, who is clinical professor of medicine at University of Arizona. Dr. Vijay is the medical director at the Arizona Heart Foundation. He has 40 plus years of experience. Nephrologist in India, endocrinologist in UK, and then he did his cardiology training and heart failure training and lipid and preventive cardiology in the US. He has 200 plus clinical trials under his belt as the principal investigator. He has numerous hundreds of publications and has served as the president of the American College of Cardiology, Arizona chapter. Dr. Vijay, we are so honored to have you here today, and we are so honored and thank you for making the time.
Humbled and honored as well, Nish. It's a great privilege to be here and excited to be here. Absolutely.
Thank you. Thank you. Dr. Vijay, if you want to, you are a world expert on obesity and preventive care. What do you think our women should know? What can they do to curb this pandemic?
What can women do to curb the pandemic of obesity? Well, it's interesting. As we know, obesity trickles into what we call it as non-communicable disease, right? So you have, obesity leads to hypertension and associated with diabetes, and then all of the lipid risk factors, and then osteoarthritis. Some of them are saying cancer is a big deal. And what's interesting is that about 50 million people die every year of what we call as non-communicable disease. So while we talk about obesity, we also should, in the same breath, talk about NCD, or non-communicable disease. And why am I saying that? Primarily because by 2030, 95 trillion, we're talking about with a T, US dollars, are going to be spent on this non-communicable disease. And so clearly, obesity is right at the top of the list, because 2 billion people are going to bed every night overweight. About 80 million are going to bed hungry. 1 in 2 Americans are pre-diabetic or diabetic, and out of which 1 in 4 are teenagers. And what we realizing now is that women have a higher prevalence of obesity and higher prevalence of some of the comorbidities that comes up, primarily because women, if they become diabetic during their pregnancy, they are at a higher risk. And so the maternal mortality is increasing, infant mortality is increasing, and thereby a lot of issues are coming up for women themselves in terms of the obesity pandemic that is out there. But having said that, men have a higher prevalence of heart attack and strokes, and women have a higher prevalence of diabetes. Women have a higher prevalence of what we call as HFpEF, which is heart failure with relaxation problem, heart failure with preserved ejection fraction. Squeeze is good, but it's not relaxing properly because of obesity, diabetes, hypertension, and so on. And what's interesting in the US, did you know, did the audience know that 47% of United States above the age of 47, okay, simple statistic, 47, 112 million people are already hypertensive. Hypertension. And that's because of the life stressors and we're not active, we're eating all kinds of junk, high saturated fat, high sugar sweetened beverages, high ultra processed food. It's all in there. And nobody teaches you what to eat. And it has to start at home. It has to start at home and build it in schools. So what can women do? So what can women do to say, help this obesity? I mean, it's all going to be number one with education, right? So it's education, education, education. So if you think about education, and if you think about healthcare, women in healthcare space like you, Nish, women in cardiology like you know, what can we do? There are at different stages of education. There are different kinds of policy that you can actually, uh, utilize, and there are policy levers. And then there are decision makers that come into the being. So if you think about undergrad medical education, think about, where you need funding, education of it, accreditation, build it in the school curriculum. Then if you think about certifying exams, graduate courses, or board exams, or continuing medical education, every step of the way, number one is obviously we need to get some funding and accreditation, but we incorporated in the school curriculum about food is medicine concept, about healthy eating habit with fruits and vegetables, fruits and vegetables, fruits and added on with every meal, and good seeds and good lentils and good healthy proteins and good healthy carbs, which is there in fruits and vegetables, and then healthy fat, which is simple things like olive oil, right? So olive oil, when you heat it up, you kind of you lose it, the fatty acid oxidation. You don't get the benefit. But if you use it raw in salads, then it's very healthy. And then use avocado oil, which has got a high smoke point, to if you want to fry anything. But why even bother fry? We haven't fried anything in our house, Nish, for I don't know, only when some special occasion. Maybe once in like 6 months we do some fried stuff at home. But other than that, nothing should be fried. So no fried foods at all. But yeah, this is important for women to talk about, the curriculum, to teach in schools, bring back the education, the cooking. So there is a program in Philadelphia called Etiquette, where they do cooking. They teach cooking skills in school. So teach them how to do from basic, simple breakfast, include which fruits to do, how to cut it, how to cut some peaches and plums, and how to get the berries in there, how to make it so artistic looking. And then, how do what kind of bread? Bread has got carbs in it. And so you want to cut the carbs for obesity. We have healthy carbs, multi-grain bread. You got protein bread, Ezekiel, Ezekiel. So you get it if you go to grocery store, it's there in the freezer section. People don't know this. And it's filled with protein, hardly very minimal carb. And if you use that bread and then utilize, peanut butter, which is a healthier butter, or almond butter, which is healthier butter, we use various protein and you mix and match. So there's a laundry list of things that are healthy from a fat perspective, laundry list of things that are healthy from protein perspective.
Thank you, Dr. Vijay. Wow, you have so much knowledge, and every time you talk, there's so much to learn from. I'm so grateful for you taking the time to be here. Thank you, Dr. Vijay. For all of you, thank you for listening to the podcast. Again, this month we had Dr. Kris Vijay, who is a world expert on obesity, on preventive care, and he taught us about what we can do in everyday life to combat this pandemic. What can women do specifically to help mitigate what this pandemic can damage? If you have any questions, any new topics to suggest, please email us at biayourselfcontact@gmail.com. Otherwise, stay safe and bye-bye until next time. Thank you. Thank you, Dr. Vijay.
Thank you very much. Thank you so much. Bye-bye.